Nikki, are you
right.
able to turn on live transcription as well, please?
Yes, that should be on. Do you guys see it on your end? Okay, good.
Yes.
Good. Perfect. Thank you. All right. So we are live. So good morning, everybody. My name is Nikki Caboose. I am currently the interim CEO of Tech Hub South Florida. And this morning we have a wonderful discussion, Health Tech in 2050. We're actually on part 3 of our series. This morning is AgeTech versus proactive healthcare. And I am going to go ahead and share my screen here. So I can give you guys a really brief overview of our organization, and then we can get right into the discussion. And everybody can see my screen, right? Good,
Yep.
Thank you. All right, so Tech Hub South Florida. Again, this morning we are having our community coffee. We do these every other Tuesday at 8 a.m. Again, it's Health Tech in 2050, part 3, Age Tech versus Proactive Healthcare. Our speakers or panelists are Dr. Gerald Wilmink, or Jerry, Chief Business Officer at Care Predict, Dr. Jessica Kordansky, founder and CEO of The Innovation Psychologist, Dr. Elizabeth Roy, Chief Medical Officer at Doctor Studio, Daniel Uribe, Chief Operating Officer, or I'm sorry, he's actually a co-founder. I don't know why I didn't change this, I'm sorry. Co-founder and CEO at Genobank. Our sponsor this morning is South Florida Business and Wealth. And we do have ASL interpretation by Beth Wagmeister from the WAG Group, or is it Workplace Accessibility Group, right? Is the new name, got it. Love that. All right, again, our sponsor is South Florida Business and Wealth. I don't know if we've got Mark on with us this morning. I didn't see us hop on, but once I'm done, if he is on, I would be happy to have him say a few words. Building South Florida into a tech hub. So this is our mission statement. And of course, with that, we have our community creed of Tech Hub South Florida is wholeheartedly committed to building a welcoming, collaborative, and inclusive community for all. We put inclusivity first, engage with others, are considerate to all, and don't sell to people. If you'd like to find out more information, you go to techhubsouthflorida.org. In short, we want to make sure that everybody is feeling welcome to attend and to the table. Tech Hub South Florida. So we are a 501c6 nonprofit organization. We are membership driven. We currently have over 200 corporate members that range from Miami-Dade County all the way to actually mostly Palm Beach County. Do have a few that are trickled into Martin County. And we do have small startups all the way to enterprise. So a little bit of everybody in between. These are just a few of our corporate members from Office Depot, Boca Code, City Furniture, Social Mobile, Crown Castle, 2 Ton, Cloud Adhesive, wearing their t-shirt this morning, a bunch of different companies again across the region. And you can visit our website and see the membership directory if you'd like to see a few more of them. A little bit about our membership. We've got 4 different corporate membership levels. Won't go through them all right now, but we do have different benefits, including different job listings, speaking opportunities, access to our exclusive member groups, and so much more. So again, if you're interested in membership, you can visit techhubsouthflorida.org, and there's a button that says join today to go through all of our membership benefits. And for some reason, it's not wanting to go to the next screen. Let's see. No, okay, it stopped liking me. All right, so I'm going to stop sharing, and I'm just going to talk at this point because I don't know why it's not liking me right now. But so to really quickly go through some of our events for anybody that's not familiar with us. In an average week, we've got about 4 or 5 events every week. So there's a lot of things to get involved in. We have our Tech Talks Monday nights at 6 p.m. We are getting back to doing them in person. So we alternate from West Palm Beach, Boca Raton, Fort Lauderdale, and Miami. Tuesdays, we alternate between our community coffees at 8 a.m. and then podcasts at 8 a.m. Lunch and learns, or our workshops, are always Fridays at noon. And then we, of course, we do have our peer groups as well, Wednesday and Thursday nights. Resume distributor. So for anybody that's looking for a job, If you go to techhubsouthflorida.org, there's a tab that says talent. And if you click on there, you can see our full job board. If you're looking through the job board and you don't see the perfect opportunity for you in the moment, you can actually click on our resume distributor, upload your resume. And once you hit submit, that goes to all of our members at once and any organizations that have signed up to receive those resumes as well. Last but not least, so we have a very active Slack channel, about 4,500 members currently. You can go to techhubsouthflorida.org/Slack and be involved in all that activity. We also have a newsletter that goes out every Monday afternoon. And if you text us your email, we can get you added there. The number to text is 561-250-7206. And I'm going to go ahead here, have each of our panelists, if you can really briefly tell us your name, a little bit about what you do, and then we'll get started with the Q&A. I'm just going to start with who's on my screen first, and I've got Dr. Kordansky first.
Good morning, everyone. I'm grateful to be on this panel with all of you and helping to make South Florida the newest tech hub. So I'm actually born in Miami, and I am the innovation psychologist, helping creative innovators and entrepreneurs in startups and tech with creative interventions. And that's it for now.
Perfect, thank you. All right, I've got Dr. Jerry Wilmink. I've got you next.
Good morning. Can you hear me okay, Nikki?
Yes, I can. Thank you.
Excellent, excellent. My name is Jerry Wilmink. I'm the Chief Business Officer at CarePredict. We're a digital health company that's located down here in Plantation, Florida, and we also have a location out in San Francisco. We are really designing the newest platform for seniors to age in place, and to also our tools are used in senior group living. There's a predictive, proactive platform that predicts when seniors are at risk for a fall, a UTI, or even depression.
Very cool, thank you. And I'm looking forward to hearing more about that. And I've got next, Daniel.
Thank you, Nikki. Good morning to everybody. I am honored to be here with you this morning and with all these amazing panelists as well. My name is Daniel Uribe. I am the CEO and co-founder of Genobank.io. Basically, we are using blockchain to use it to tokenize or to digitalize all the biosamples and pair it with a cryptographic wallet. So we are enabling all the donors or patients to own and control their genomic information using, again, this very new technology or blockchain. That's my background is in cybersecurity, and again, it's a pleasure to be here this morning.
Very cool also, thank you. And last but not least, Dr. Roy.
Hello, everybody. Thanks again for having me today. I appreciate the opportunity to meet all of you and to participate in this conversation. I am a functional and regenerative focused physician. I help empower people to really stay well or get well, if it were. You know, a lot of individuals are pre-disease, and I use technology to help them understand how it is that they can empower themselves to reverse that course and to stay on a wellness trajectory. So it's an exciting time.
Very awesome, and thank you. And again, for anybody that missed it in the very beginning, I was loving her background. That is real. She is in the office this morning. All right, so to get started with our Q&A here, I'm actually going to start with Dr. Wilmink. Can you just help us kind of begin this discussion by explaining what is exactly AgeTech, or referred to as SilverTech, for our audience or anybody that may not know?
Yes, so right now, seniors, especially now during this pandemic, seniors are particularly been aging in place in their own homes, trying to stay safe. And many of their caregivers live hundreds of miles away. And so the challenge is we want to provide the best care possible for those seniors, However, we are physically at a distance. In order to do that remotely, we really need technologies to better understand what those seniors are doing in terms of their daily activities and behaviors. And if we can get that information in a continuous and autonomous manner, we can get upstream from health declines. And for instance, if they're suffering the early signs of depression, or they're even struggling getting up in the morning or visiting the restroom more frequently than usual, those could be the kind of the early precursors or the signs that they may in fact be suffering depression, a urinary tract infection, or elevated risk for potentially a fall. So for years, technologies have been developed in a more reactive manner. So I fall and I can't get up, one of the most famous kind of PERS devices, and that really simple message is actually probably what, a good piece of the success of that device is that if a senior falls, they can press the button on the PERS device and it can call for help. That can be a 911 center or a family member. Over the past few years, maybe last 10 years or so, technologies have been able to start reacting and have automatic fall detection. And so now seniors are wearing these devices, calling for help when they need it, or the device is actually autonomously picking up a fall. Fast forward a few more years, we've started to see ambient intelligence devices, which basically we have been retrofitting alarm technology, that ADT and others have been using for years to sense the motion of an individual in a particular room. So for instance, if I walk into the kitchen area, the motion sensor says something or somebody is in that kitchen area. And those technologies then were used to determine, okay, somebody was in that kitchen area. We're going to say it was Jerry, and he was eating ice cream again for this period of time, right? So huge leaps of faith were used with these motion sensors because it really didn't know if it was Jerry. It could have been my wife, or it could have been my children, or it could have been the dog going into the kitchen area. So a lot of these systems got a lot of pushback because they had a lot of false positives saying, well, this person really wasn't in that kitchen. It was Jerry's wife, Kimberly. So there was no way to differentiate one individual from another. With our technology, I think it's one of the most unique technologies, but it's called CarePredict Tempo. And it is a wearable device that's worn on the dominant arm of a senior. And what it does is it picks up the subtle changes in kinematics of the senior's wrist and then identifies whether they are eating, washing their face, brushing their teeth, based on those subtle changes in kinematics of their wrist. And the way it works is it uses a context location beacon to know which room in the house or in the community they are in. Because the eating gesture and the brushing teeth gesture may look very similar if you just look at the raw data. However, if you know that the individual's in the bathroom versus the kitchen area, you can have a higher probability, higher fidelity prediction on what that person is doing, whether they're eating or actually brushing their teeth. So that data is fed to our platform, which then makes predictions. So I see our systems as kind of really the beginning of predictive, proactive technology for seniors that are aging in place, and allowing us to continuously and autonomously measure that information.
Awesome. Thank you so much. So hopefully that was a wonderful description for everybody that's not familiar with SilverTech or AgeTech. So thank you, Jerry, for starting us out there. To follow that up, Dr. Kordansky. So we are talking about, obviously here, the differences, or I guess the verses of AgeTech and proactive or preventative medicines. So can you explain what proactive healthcare is and a little bit about the areas of healthcare that this may encompass?
Absolutely. So, we can start with an analogy. It's almost like offense versus defense, right? We can be preventative and proactive and take charge of our health, or we can wait for an illness to kind of creep up and then we're playing catch up. So screenings are one area that especially integrated primary care practices will kind of meet the patients where they are, whether they're depression screens, alcohol screens, diabetes screens. So these integrative practices now really do a great job of gatekeeping to help patients from a more primary prevention perspective. So that's one particular area. Obviously, there's cardiology now is doing a lot of prevention. A lot of these osteopathic physicians are trained more in the preventive medicine, arenas than the typical mainstream MDs. Obviously, nurse practitioners also are gatekeepers as well. Obviously, there's a lot of robotics and AI right now in terms of deep learning, machine learning. A founder was recently consulting with me on a technology of his where they're using robotics and AI to incorporate motivational interviewing and all sorts of preventive questions and measures as screeners before the patient actually has a first encounter with a physician. So prior to becoming the innovation psychologist, I've been in private practice for about 10 years as a health psychologist. So I see, a lot of oncology patients many of whom are involved at University of Miami, Sylvester, and they're really happy with the patient portals there through their MyChart, where they're just more easily able to, interact directly with their physicians, and they are basically in the driver's seat and they're collaborating more, they're feeling more empowered, and they feel less like a victim. And then also, obviously, all the physicians are able to kind of see that patient's chart and work in a more interdisciplinary fashion. And I really think COVID has taken things to the next level in that regard, because in 2010, I had joined an early stage healthcare startup down here in South Florida, and Medicare was really only just starting to cover some of these screenings. But unfortunately, they weren't paying for things in a preventative fashion with, for example, a patient that was maybe borderline diabetic, who was just getting close to a type 1 or type 2 diagnosis and really could have benefited from some nutritional counseling from a dietitian. But instead, they had to wait until they were officially diagnosed to get any intervention. So I'm seeing that over the last 10 years, we were almost, too premature. People weren't ready for us, or maybe Medicare wasn't ready for us. But now you're seeing, even telemedicine practices being covered. As a psychologist, I wasn't even able to perform telemedicine until COVID. So this prevention, I really think, is taking off even more than it ever has before COVID.
Wonderful. Thank you so much, Dr. Kordansky. And I know we've got a couple questions in there later on in the discussion, but I'm definitely interested in hearing about, what's going on in the psychology realm too, because not a lot of people even think of that first off when it comes to their healthcare. They always think of what's hurting or what's their ailment. So I'm definitely looking forward to that. So Dr. Roy, in preparation for this discussion, of course, I was doing some research, trying to get some, interesting numbers. And one of the things that I came across was, it says that the World Health Organization estimates that over 50% of the global burden of disease is chronic disease. I knew it was high, didn't realize it was 50%. So chronic diseases, again, for anybody that may not know, are long-lasting, having compounding, sustained effects on the social, physical, again, psychological, and economic levels of the individual and broader society. So the question here is, do you think that our current healthcare system is equipped to handle this growing concern, especially being at such a high rate?
Yeah, that's a great question. I don't think that we're well equipped, in fact. But I think it's going to take an entire mindset shift to really properly reverse this trend. In fact, in the United States, so that the WHO numbers that you're citing are worldwide. In the United States, 97% of all healthcare dollars are spent on preventable, reversible, in fact, in many cases, chronic diseases. And that, to me, is a complete failure of the healthcare system. I don't work within our current insurance model. And fortunately for me, I'm one of the lucky ones who really, I serve my clients, my patients at a different level. We're very proactive and not reactive. Our entire healthcare system as Dr. Kordansky was saying, is really reactive. And so you have your pre-diabetic who, to me, that is a delayed diagnosis as well. It should have been noticed 10 years ago when there were cellular changes and predictable disease paths, if you will, or trajectories, if you will. So a reactive healthcare system is absolutely never going to be able to change this chronic disease trend. It's really a shame, I think. Through medical training, we are not trained to support health, and we're not even licensed to support health. We're licensed to diagnose and manage disease. And in my own life, that certainly didn't check any of my boxes. I needed to have many years of additional education in order to be able to help advise people and connect people to the truth about how much power they really have over their health and wellness. When I say a mindset shift, I really mean a foundational mindset shift. Most people who are suffering from chronic disease don't realize that they're in charge of all of it. I'll often say to a new client, well, the bad news is you're a mess. The good news is you actually have control over all of it. And so let's go ahead and get to work to do that. So until there's a real shift in the mindset, I think we're headed for even bigger trouble if unfortunately.
Thank you, Dr. Roy. And I did want to just say, I guess from me personally, just thank you for being, a medical practitioner and a clinician that actually sees that and recognizes that, because I'm not going to say any names. I've got quite a few friends. I came from the healthcare industry that are physicians that would never tell you that a lot of their education and learning was kind of backwards. And so I'm happy to hear that, people are looking at it the other way around. So thank you for that too. And did any of the other panelists want to follow up on Dr. Roy's statements there? Please feel free if you do.
This is Jerry. Yeah, can you hear me okay, Nikki?
Yes.
Excellent. Dr. Roy, thank you. Your statements really resonated with me. One of my last partners in my last digital health company, Dr. David Katz, used to say, fingers, forks, and feet. And that was his thing. The feet is the physical exercise, things that we're in control of for, to reduce or, solve and address the challenge of chronic diseases. So feet, physical activity, forks, what we're eating healthy, making those healthier choices, and then fingers, not, consuming too much alcohol or smoking or things that are with our fingers, bad habits. So when he said that, it really stuck with me because it was like, oh, I can use that. I can remember that going forward.
Right.
Yep. And on the proactive side, one thing I forgot to say is with my children, I have 3 young children, 11, 9, and 7. And whenever I'm getting dressed for one of these show and tells, I explain to them how our product works. And one analogy that I've always used is our CarePredict app and the wearable really serves as kind of a check engine light for grandma. So for my grandma, we can see what she's doing and when she's starting to be at risk for, the early signs of depression. If she's not getting her exercise or she's skipping meals, we can see those early signs and make sure that she gets the proper care then.
That's great.
Wonderful. Thank you. And my next question, actually, I think kind of with some of your statements there, Dr. Roy, were perfect to kind of lead us up to my next question to Daniel here is, so another one of stats that I found, the American Medical Association states that about 100,000 deaths annually are preventable, again, which is huge. Within the last decade, there's been a lot more focus on taking an active role in our health and making a healthy lifestyle changes that support wellness of our whole being. So again, body, mind, and spirit. a biologist, Dr. Leroy Hood, coined the term P4 medicine. Daniel, can you explain what P4 is and what that means to everybody?
Of course. Thank you very much, Nikki. Can you hear me well?
Yes.
I hear a little bit of echo there, but okay. No, thank you very much. So the P4 is, I believe, a term that was from 2013 or something. I mean, those days, and it's literally, I believe, very simple to. I mean, I actually believe doctors already here can have described it, but it's very simple. I mean, it's predictive, preventive, personalized, and participatory. Right. I mean, it's in a nutshell, is all about being patient focused, and is not only just like the clinical side or the doctor just being the driver, using the analogy of being in a car. It is essentially what we were talking about some minutes ago, that putting the patient in the driver's position and not as a co-pilot. This obviously is now we are in a technological age where now we have networked patients and activated consumers, and they are increasingly demanding personal information, right? Even in this now, obviously in the social aspect, but more and more now in the medicine side or in the healthcare side. And this information is being used to improve health, and all the information right now is being converted into big data, right? Like Dr. Jerry was describing, one amazing platform that he is leading or invented about how to predict the behaviors of a human being in order to protect the seniors, right? More. And obviously this is the future today, let's call it that way. And of course, these are complex predictions, because it can, as he said, maybe fall into a false positive category. But systems are really getting very, very smart, or very trained in the AI world. And yes, this will lead to save many lives and reduce, obviously, the incidence of disease. And this also will hit, hopefully, into, or will help to provide more cost-effective healthcare as well.
Thank you, Daniel. Does anybody else want to follow up that as well? If there's anything you'd like to add.
Yeah, this is Jerry. I'd like to add one piece that was excellent. Thank you, Daniel.
Thank you.
I was looking up this data recently. The CDC and STEADY have launched an entire effort now to really push things to be more proactive, in particular for senior falls, because we're seeing that the fall death rates in the U.S. have increased 30% since 2007 to 2016, and the data shows that if these rates continue, we could expect 7 fall deaths every hour by 2030. So the mindset has always been, I fall and I can't get up. Let's react to that, right? And which is great, because you don't want a senior to suffer a long line. But the reality is, we want to avoid the fall altogether if we can. And the only way to do that is to capture enough information on that individual ahead of time that we then can participate, and actually intervene to strengthen their muscles, to improve their mental health, do those things. That way they do not fall, they maintain stronger balance, and I think getting ahead of the curve on a proactive side, that's what we're starting to move towards. And we need different types of tools to get that data in a continuous manner, to help improve the health of those seniors.
I'd like to chime in too, Nikki, if you don't mind. So I thank you, Jerry and Daniel, that's, what the work that you're both doing is really awesome. I want to just take us back in the conversation. And when we talk about technology, I use lots of technologies here at the office. And one of the technologies is genetic testing. And so, for instance, when we now have the ability to sequence someone's entire genome, run a report which gives us actionable data about how to support someone's genetics. And I think that the conversation should really start there in educating people about how to empower themselves for wellness. And so, it's wonderful to have all kinds of different technologies, but when we can really connect people to understanding what it is that they need to do to be well, that's real personalized medicine. So genetics loads the gun, if you will. Epigenetics pulls the trigger. It's one of the things that we say a lot in functional medicine. And what that really means is you come into this world with a certain set of vulnerabilities. And what happens to you while you're here, food, toxins, different pathogens, affects your genetics, and that's what actually causes disease. There are less than 3% of disease that we see, actually it's much less than that, is actually right. So someone will say, well, I have this particular problem, it's genetic. And I'll say, well, does that mean, does your father have the problem? Does your mother have the problem? No, I'm the first one. It's epigenetic. It's a leaning vulnerability. So we can even take charge of our wellness now at that fundamental level. So if you can understand what your genetics are and how to feed your body to support those, then it simply means that you are strengthening the chain, if you will. You're decreasing your vulnerability. So we can use kinds of technologies now to start to create a health trajectory. So from the beginning and the end, when we talk about the SilverTech age.
Thank you.
Nikki,
Yeah,
if I
go
may,
ahead. No,
thank you
yeah, I
very
was
much.
going to say
because-
this is a perfect segue for you. I was going to skip a couple of questions there down the Q&A line. Go ahead, Daniel, because I know that this is definitely your realm, this part of the discussion.
Thank you very much. Well, actually, I mean, it's very interesting because Dr. Roy was what she was describing is like there's now a new well not I don't know if it's new, but is the digital twin, right? A lot of companies are trying to build like digital models, right, of each of us, literally, that will combine the genome, the exome, all the multiomics, right? And then try to build models that could, be used to run some algorithms or AI-based models to predict what Dr. Roy was describing exactly. Our mission, I wanted to tell you that obviously we are in the shoulders of giants in science. We are a cybersecurity layer. We are not interpreters of the data. We are more like custodians or encrypt. We make sure that the data is encrypted, but we through this blockchain technology, we are making sure that the donor have, or the patient has, or the family members have a say into the how the data is managed. And we literally are using this very new technology called blockchain that is literally cryptographic signatures in a distributed ledger. I mean, this is a little bit technical, but at the end of the day, we want we are looking into this world where genomic information, for instance, as Dr. Roy was describing, is the baseline or the cornerstone, and we're starting there. So we are creating an individual vault, to keep the raw data coming from any biosample where your DNA or your RNA, in this case your transcriptomics, are extracted. And we make sure that the raw data is cryptographically identifiable and linked to a person that can control who has access to it, why, when, etc. Right? So it's literally a token for privacy, right? Privacy for us is very important, and this is where I introduced the fifth P, right? So we were talking about the 4P system. I believe now is very, very important to talk about the fifth P. The fifth P is privacy, right? So in order to scale to 1 billion genomes network, the main column would be privacy, because we have never seen companies like 23andMe or Ancestry, and they reached 10 million, maybe 20 million users. People start to decrease the participation in those systems, and the number one concern is privacy. So in a nutshell, our mission is to empower the scientists, empower the doctors, so they can continue this flow of information. But the psychological aspect, very important, that Dr. Kardansky was mentioning, is very important. And one aspect is the peace of mind that my data will never be used against me, right? Because it can be super useful in the case, let's say, feeding the platform of Dr. Jerry, right? It could be as life-saving. But now if I turn this information and I start selling it to everyone, even insurance companies or governments, or people or persons that might not be as interested to be like making decisions that will positively impact my family or myself, then I need controls, I need firewalls, I need privacy, literally. And that's exactly what we are trying to provide in this digital twin era.
That's really important too, Daniel, because I didn't even think of that piece. There's a lot of conversations around data in healthcare, and I think privacy, yes, should be certainly the fifth P. So I thought that was pretty smart there. I do want to see, part of this conversation that I do feel like we're missing here also is the cost savings piece. So, our healthcare right now is completely based on when you get sick, the healthcare system makes money, and it's this negative cyclical cycle there. But how can preventative, healthcare actually be cost savings to us as individuals? Is there anybody that can help share some light on that here as well?
I'm happy to give the world a view of that.
Sure.
Productivity improves, general satisfaction of life improves, relationships improve. That to me is certainly foundational. The financial piece of it, in my mind, is obvious. Medications are very expensive. Insurance is increasingly costly. Certainly a hospital stay is not inexpensive either. But we need to start measuring things in terms of quality of life, right? So there's longevity, there's a focus on cost savings, all of this, and access. Really, quality of life is, in my mind, the key, and something that we've lost sight of. And so productivity and satisfaction and all of these cost savings are very important, but you cannot put a value on that quality of life. And one of the things that I think we keep doing is, we dehumanize these solutions, right? We now have synthetic beef. We have this technology in form of food. I mean, we're nuts. We're crazy. We need to back up a little bit and say, okay, how do I plug back into who we really are? We keep this going in this big circle where we say, well, we have a human problem. Let's solve it with, some sort of technology. We get further and further away from who we really are. And the fact of the matter is, synthetic beef, in my humblest opinion, is a ridiculous thing to even consider, because at most basic levels, when we talk about information and technology, food is information. This is the machine. And food is the information. And so what kind of information are we actually putting into the machine should be its own discussion. And how do you support a lifestyle where you're surrounded by good, healthy choices, right? Instead of profiting from creating some unique synthetic solution to a very organic problem. So when I say mindset shift, I really mean fundamentally. That's proactive.
Yeah, I think that's perfect, Dr. Roy, too. And Jerry, were you going to say something there?
Yeah, this is a fantastic question, Nikki, and really, what we're trying to demonstrate with predictive proactive solutions and platforms is that we can improve the life of those individuals, and that means a lot of different things. And so, what we did as an organization at CarePredict, we actually worked with our partners and conducted a 2-year study. I previously did my PhD in biomedical engineering at Vanderbilt, and so every now and then I still get to do some deep work and publish. So we did a 2-year study at CarePredict with some of our partners to demonstrate some of those outcomes. So we looked at close to 500 seniors, 250 that were in our control group, that were in senior group living communities that were not using CarePredict, 250 that were using the CarePredict product, including the staff. And what we demonstrated at the end of the study was that we could reduce the hospitalization rate in the CarePredict installed communities by 39%. So now by reducing the hospitalization rates, that can make a significant difference on not just the quality of life of the seniors, but also the occupancy rates and things for those organizations that let them operate in a healthier manner as well. 69% reduction in fall rate we also observed. And this is, similar risk profiles across all of these communities that we worked in for this study, and also increased the length of stay. And probably another important piece we found is we improved the staff response time. So when the seniors needed something, whether it was concierge services or needed attention, and they communicated using their wearable device, the staff responded much more quickly and attended to their needs. And that provided a higher quality of life and experience for those seniors in the group living environment. So all of these were incredibly positive, but those were the metrics, as Dr. Roy was mentioning, is reducing the hospitalization stays and reducing the falls, which can be kind of the last straw for a downward spiral for many individuals. So that publication is in JMIR Aging. I'm the first author on that, Wilmink, artificial intelligence powered digital health platform. But it actually walks through each of those KPIs and the metrics, because it's important. It's difficult. I think that's the most challenging part about predictive proactive solutions is you need to do a very controlled study to show you can reduce some of those rates, because it's the bullets that you're missing now, and that's much more difficult to demonstrate.
I do love the discussion that's come up a little bit here, from Dr. Roy and some of the other comments as well that you all have made, is just that I think that healthcare right now is so much about, where does it hurt? What's your ailment, or, what are you dealing with right now? Instead of looking at the person as a whole. And we were talking about, like Daniel, with genomics and all of that information. And I do see that a lot of that is starting to change, where we are talking about predictive and preventative medicine more and more and more. And people are starting to look at fitness and food and even mental health, and doing that before an ailment happens. And I did want to give Dr. Kordansky a moment here, is, because obviously, like I was just saying, that age-old question of where does it hurt doesn't really allow for predictive or preventative discussions around healthcare. So can you explain, with what you do as a psychologist, how do discussions about mental health come up, and why is this important to include in the awareness of our overall healthcare plans?
Absolutely, I'd be happy to. So luckily, mental health is becoming more destigmatized. I think people were kind of scared to even talk about the D word, or talk about anxiety, or talk about addiction. But because so rampant right now, people are open to having that discussion. So even within integrative primary care practices, as Dr. Roy and the others have mentioned, it's not just epigenetics, it's the biopsychosocial model. It's using motivational interviewing to be able to catch someone where they are. And in terms of even these cost savings too, diabetes and obesity is reversible. I used to do pre-surgical evals for bariatric patients, and many of them often regained the weight. So I said, let's see if we can incorporate some, behavioral strategies and really face this more directly, that really understand what's going on emotionally that's causing these patients to overeat. And I actually helped over three people lose over 100 pounds. So it's really meeting the patient where they are, or giving the patient what they want, and then showing them what they need. And really thinking about this overall holistic model. I'll always stress wellness over illness, or mental health as mental wealth, and even the gamification of mental health, using these structured approaches. Like I helped when I trained on my fellowship at Emory to create a stress and biofeedback clinic. And we had a lot of students and faculty who didn't actually believe that they could change their physiology and lower stress, and learned, that stress is fueling illness. Stress fuels the common cold. Stress definitely is a driver in many of these, illnesses that are just rampant in our country right now. So as people saw that they were able to, put electrodes on them, and through relaxation and self-monitoring strategies, they were actually able to effectively change themselves from the inside out. Their biology was actually changing as they were incorporating some of these strategies. And then you've got internal locus of control, external locus of control. And, Candace Pert actually, talked about incorporating the discrepancy of mind and body into one word: body, mind. And an old mentor of mine used to say, we have a neck for a reason. I think we are very, physicians now are very much focused. You go to an orthopedic, they're like, sorry, I'm an elbow guy, I got to send you to my knee guy. And I think we really need to kind of step back and stop looking at patients under a microscope, and maybe look from like a drone perspective, or even an eagle perspective, and really start getting curious around what emotional reasons might be manifesting themselves physically. And then again, as Dr. Roy mentioned too, like we are what we eat, literally, and an ounce of prevention really is worth a pound of a cure. And I'm not sure if anyone here has heard about this new Blue Zone, these programs and studies, but whether it's like following these longevity products in Okinawa or Sardinia or certain parts of Los Angeles, there's actually programs now that are coming here into the US. And one of the initiatives is actually in Orange County, Florida, where they're really teaching people how to make behavioral changes now, so that it's not just let's focus on youth because they're our legacy, but why can't we focus on youth and also older adults to promote health and well-being, and just have more centenarians. So it's entering the conversation. To kind of follow back to your question, mental health definitely is having an increasing larger role and seat at the table, so to speak, because people are realizing that, we can't just be Western in our approach, but if we can actually integrate Eastern approaches of more non-traditional holistic methods, people are seeing that it's just augmenting their current treatment. It's not going to take anything away. And that also goes, with these artificial intelligence. I think, some humans are worried that their jobs are going to become obsolete. And if anything, it's an art and it's a science. And I think they can really work, more cohesively together.
I just want to say, OMG, I loved everything that you just said. I'm like, I don't know if there's one thing that I could have taken from that, but yes, I agree with all of that. And that was wonderful. I know we've got just about 5 minutes left. I do have an old friend of mine and a special guest here, Dr. Krongrad. I know that you had asked to say a couple words. I'd love to be able to give you a moment just as we're closing out here to make any, ask any questions of the panel or make any comments that you wish as well.
Thank you. So with 5 minutes, geez, I'm not going to get too far because there were just so many great points. So my overall observation, if you'll allow me a moment of candor, I had no idea what to expect. And hats off to you, because it's just so rare that I meet a new group and feel just so lucky. The panelists are great. I want to know more about every one of them and their work. The data that Jerry just shared that I just quickly looked at, wow, 69% lower fall rate. You never see 69% improvement in anything. If that's reproducible, this is an incredible contribution. People need to know about it, not just our group. Lisbeth, geez, I need about 15 more lunches with you, because the question is, is healthcare complicated? Is it technology and molecules and artificial intelligence and routers, or is it simple? How do we want to approach it? The reality is the body is incredibly complicated, right? The genome is incredibly complicated, but the levers for health are actually very simple. Adequate protein, adequate resistance training, adequate sleep, right? Take a nap, eat your breakfast. I mean, it almost comes down to grandma's, 5 principles for don't be an idiot, basically. The problem we're facing is money, corruption, right? So if you talk about chronic illness, which is what's going to kill us as a species, as an economy, the root of that, in my opinion, is commercial interest, right? So sugar is cheap. We box it, we put Tony the Tiger on it, and we sell it, but health deteriorates. I don't have the solution. I really don't. I sometimes feel like we're on the Titanic, and the best I can do for my friends is build a life raft, which is kind of what I think your practice is about. You're taking them one at a time and building them life rafts. I don't know if this is the group, to really tackle the bigger problem of corruption, which in my view goes back decades at this point, to McGovern, McGovern forward, USDA. Anyway, I've got a million thoughts. I'd love to know how this group can reinforce itself. Not only the panelists, but how do we anchor the other participants? How do we bring in more people? How do we help each other, help Tech Hub achieve its mission? I don't have answers yet. I just met you, but these are my questions, and I applaud you for putting this together, and I appreciate the invitation.
Someone needs to put together a common sense hub.
Right,
Yeah.
right. Well, you guys are definitely all welcome to our new peer group. I don't know if you guys saw, Monica had dropped that in the chat there. We did start at the beginning of this year. We had actually 8 other different peer groups who just started our health tech and life sciences peer group. And we are looking to invite more people to the table, want to have more of these discussions. Like I said, this is the 3rd discussion around health tech and life sciences that we've had so far. And I'm hoping that it'll be of many. I am actually, because I didn't want to forget this, going to drop in the chat. We are going to have our 4th and final panel discussion at the IT Expo, which is June 22nd through 25th. And actually on the final day, they are giving us an area there where we have a breakfast and networking hour. So we'll make sure anybody that's attended any of these talks, we will send an email out, let you guys know more about those discussions and what's going on. But again, anybody that's either involved in this panel, watching this morning, or even watching live, if you are involved in healthcare, health tech, life sciences, and would like to be a part of that peer group, please reach out, let us know, because we definitely would love to have more of these conversations and figure out how we can educate our South Florida community better in these discussions. So we are right at time. I try to keep, pretty time specific to be, I know everybody's got jobs. So thank you so much for showing up bright and early. Again, Pete, yes, it is bright and early. And again, thank you to the panelists. Really appreciate all of you, Jessica, Jerry, Daniel, Elizabeth, and Arnon as well. And do want to give a shout out to just our internal team. Monica Rojas helps us with coordinating all of our programs. And then Pete Martinez is here this morning as well. And Maggie Solomon, they are both Pete and Maggie are our chair and co-chair of our peer group. So again, thank you very much for everybody, and hopefully you guys all have a wonderful day.
Thank you so much. Thank you, everyone.
Thank you.